Cardiac output is the topic of this screencast. You may find information on cardiac output in Chapter 11 of your textbook. This screencast was designed to help you achieve the following objectives. Define cardiac output. Write the equation for cardiac output. Explain the effects of various factors on heart rate. And explain how preload, afterload, and other factors affect stroke volume. Cardiac output is the volume of blood pumped by the left ventricle each minute. It is used to estimate the efficiency of the heart, and it also reveals blood flow to the tissues of the body. The formula for cardiac output is stroke volume times heart rate, where stroke volume is the amount of blood pumped by the left ventricle every time it contracts or beats, and its units are milliliters per beat. Heart rate is the number of contractions of the left ventricle per minute, or beats per minute. So let's use our formula to calculate normal cardiac output for a resting individual. So the resting stroke volume is typically 70 milliliters per beat, and normal resting heart rate is 75 beats per minute. Using our formula, we get 70 milliliters per beat times 75 beats per minute. The beats cancel out, leaving 5,250 milliliters per minute as the cardiac output. The body contains roughly 5 liters total blood volume, which means that the heart pumps roughly your total blood volume every minute. To understand what factors influence cardiac output, you must know the formula for cardiac output. So I am requiring you to commit the formula for cardiac output to memory. So now let's look at what can influence cardiac output, starting with what influences stroke volume. The vasomotor center, located in the medulla oblongata, controls heart rate by stimulation or inhibition of the cardiac muscle cells of the SA and AV nodes. Sympathetic fibers, shown in green, increase heart rate by causing cardiac muscle cells of the SA and AV nodes to fire and contract more frequently. Parasympathetic fibers, shown in red, decrease heart rate by causing cardiac muscle cells of the SA and AV nodes to fire and contract less frequently. Recall that the autorhythmic cells of the SA node contract at a rate of 100 times per minute. The effect of the parasympathetic fibers on the SA node slows the resting heart rate to 75 beats per minute. Since the parasympathetic fibers extend from the vagus nerve, this is referred to as vagal tone. So vagal tone is the resting heart rate as established by the parasympathetic nervous system. Various substances in the blood can also affect heart rate. Thyroid hormones produced by the thyroid gland increase heart rate. Epinephrine also increases heart rate. Both increase the rate at which cardiac muscle cells of the SA and AV node fire and contract. Body temperature can also influence heart rate. An increase in body temperature increases the rate at which cardiac muscle cells of the SA node fire and contract. A decrease in heart rate decreases the rate at which cardiac muscle cells of the SA node fire and contract. Also note that electrolyte levels in the blood, electrolytes such as sodium, potassium, and calcium, can also affect heart rate, although I will not go into detail as to how. So we've talked about how hormones and electrolyte levels and body temperature can affect cardiac output by affecting heart rate, now let's talk about what factors can affect cardiac output by affecting stroke volume. Of course, you know that the more you stretch an elastic object, the more forcibly it will recoil. The farther you pull back on a slingshot, the farther you can project an object. The same is true of cardiac muscle cells. The more they are stretched, the more forcibly they will contract. This relationship between the stretching of an elastic object and how forcibly it will recoil was captured in Starling's law of the heart, which simply states that the greater the degree to which the cardiac cells of the ventricles are stretched, the more forcibly the ventricles will contract. In other words, the greater the end diastolic volume, or what is called preload, that is, the greater the amount of blood that's in the ventricles just prior to ventricular contraction or systole, the greater the amount of blood will be pumped by the ventricles when they contract, which is stroke volume. Venous return is the amount of blood entering the heart. Remember, veins bring blood back to the heart. So venous return is the amount of blood entering the heart. As venous return increases, the amount of blood that is returned to the heart increases, the end diastolic volume, or the preload, will increase. As the preload increases, the walls of the ventricles will distend and stretch. The greater the stretch, the more forcibly the ventricles will contract during ventricular systole. The end result, the more blood enters the ventricles, the more blood leaves the ventricles during contraction. Exercise increases venous return because as skeletal muscles contract, they squeeze veins, milking those veins, pushing blood back toward the heart through those veins. Therefore, exercise increases the preload and thus stroke volume. Hemorrhage or loss of blood will decrease venous return, which will decrease preload and stroke volume. Contractility is the strength of contraction of a ventricle at a constant preload. Stroke volume therefore increases as contractility increases. Any substance that increases the flow of calcium ions into the cardiac muscle cells will increase contractility, or the force of contraction of the cells of the ventricles. Sympathetic stimulation of ventricular cells increases contractility. Several hormones such as epinephrine from the adrenal gland, glucagon from the pancreas, thyroid hormones, all of those hormones increase the force of contraction of the cells of the ventricles by enhancing the flow of calcium ions into the cardiac muscle cells of the ventricles. Digitalis is a drug that is given to patients in heart failure to increase the contractility of the cells of their ventricles, increasing the stroke volume. Calcium channel blockers decrease contractility by decreasing the flow of calcium ions into cardiac muscle cells. So as contractility increases, stroke volume increases. As contractility decreases, stroke volume decreases. So as blood flows through a blood vessel, wherever that blood is in contact with the walls of the blood vessel, there is friction. Friction that resists the flow of that blood. When the ventricles contract, they have to push blood against that resistance. And that resistance is called the peripheral resistance or the afterload. And as the afterload increases, stroke volume decreases. The size of the blood vessel has the largest impact on peripheral resistance. As blood vessels dilate and the diameter of the blood vessel gets larger, that causes a decrease in peripheral resistance. As the blood vessel constricts or vasoconstriction occurs, the diameter of the blood vessel gets smaller, and that increases peripheral resistance. So vasodilation decreases peripheral resistance and increases stroke volume. Vasoconstriction increases peripheral resistance and decreases stroke volume. Now let's review the objectives of the screencast. Define cardiac output. Write the equation for cardiac output. Explain the effects of various factors on heart rate. Explain how preload, afterload, and other factors affect stroke volume. The topic of the next screencast will be the structure and function of blood vessels.